We're going to be hearing this term a lot in the next few years, and it's called fuck around and find out. Now, recognize this is a terrible thing to happen to any community, and it should not be celebrated in any regard, but this is a prime example of we need to educate ourselves before we elect officials into office. Cute little rural town in Nebraska voted by a margin of 74 to put Donald J. Trump into office, and now they are facing the consequences of their actions. They have earned the fruits of their labor. This is the result that they must have wanted because this is what they voted for, right? Of course, this isn't what they wanted, but it's a little bit too late to be regretting your decision now, isn't it? Only positive we can hope for is that if we make it to a next time, people will start educating themselves more. That's it. See ya.
That one of y'all remaining hospitals has just announced that they're closing. Yeah, Nebraska, you're losing your hospitals too.
See, Nebraska is probably really pissed that they voted for Trump now, huh? Because everybody that's like, no, Medicaid's not going to close clinics and Medicaid's not going to close hospitals. Ask Nebraska how one of their clinics is now being closed. Why, you might ask? Because of Medicaid cuts. Because of Medicaid cuts. And that's just the first to downfall publicly. Imagine all the small ones that's going to close without the public knowing. And yes, my face is greasy because I got on sunblock because I'm about to get outside. But listen, I'm trying to tell you, it is about to get real ugly in America. Y'all just wait and see all you nurses and CNAs and LPNs and doctors. Yeah, you might want to go look for a new job because you're about to get terminated. Thanks to Trump. Go thank your president.
Hospitals are already closing because of the big beautiful bill. Not next year, not next month, now. In Nebraska, a hospital already closed. In West Virginia, 7 are at risk. In Georgia, $540 million in cuts. 4 hospitals likely to shut their doors. In Oklahoma, 23 rural hospitals at risk, now. This bill slashes $1 trillion from Medicaid. They're throwing a $50 billion rural hospital fund at it, but that's like giving somebody a Band-Aid after you cut off their arm. We're talking maternity wards closing, ERs shutting down, ambulances gone. People driving an hour or more just to get emergency services. And if that one rural hospital was the biggest employer in town, the whole town suffers. Trump said this bill was beautiful, but the people living in those communities just lost their hospital, their lifeline. And if you thought this bill was about saving money, this bill is going to add $5 to $8 trillion to the deficit over 10 years. And I'm going to tell you this right now. When Democrats next take the presidency, and it will happen, power shifts. It has my whole life and yours. This big, beautiful bill will be fully in action. And who do you think the Republicans that voted for this bill is going to blame for the effects of this bill? I think the answer is obvious, because Republicans just can't seem to find themselves doing the right thing. And that's the truth.
So yesterday, Nebraska Representative Don Bacon announced that he will not be seeking re-election. But then he turned around and supported Frumpy Dump's big, despicable disaster. Now, he defended the controversial bill in an interview, acknowledging concerns about the Medicaid changes while emphasizing what he sees as critical benefits for the middle-class Americans. Now, we all know because of the Medicaid cuts, many rural hospitals are uncertain about their future. And that is no more true than in Nebraska, his very own state. A rural hospital has already started the process of closing down because of their funding uncertainty. Curtis Medical Center announced that they will be closing their clinic. They have proudly served the Curtis community and surrounding areas for over 30 years, providing essential healthcare services to families, students, and individuals in this rural region. But the decision to close the facility was not made lightly and followed an extensive evaluation of financial sustainability and resource allocation. The president and CEO of the hospital said, unfortunately, the current financial environment driven by anticipated federal budget cuts to Medicaid has made it impossible for us to continue operating all of our services, many of which have faced significant financial challenges for years. Don Bacon was confronted about this hospital closing, and this is what he wrote. The hospital isn't closing because of this bill. That's silly. Again, the CEO says, unfortunately, the current financial environment driven by anticipated federal budget cuts to Medicaid has made it impossible for us to continue operating all of our services. Don Bacon was not running for re-election. He can't defend the indefensible. He let his own people down because Frumpy Dump made promises to his billionaire friends that they were going to receive these tax cuts. And now, because of Don Bacon, those citizens in that area will not have access to health care. It's already started, and the bill ain't even been signed into law yet. And this is only the beginning. Just wait. Just wait. All right, players, put your thoughts in the comments. Don Bacon is a coward, and he should be ashamed of himself. But I'm not surprised by Don Bacon. He's been ridiculous all over social media, taint sniffing for Frumpy Dump for years. And it doesn't surprise me that he sucked his taint once again at the expense of his very own neighbors, his own constituents. Put your thoughts in the comments, players. This is Double D Mo for the Black Heart News.
FAFO season continues, and someone says, I wonder if the hospital in Nebraska closing has anything to do with the president. Let me know in the comment section down below. And what are your thoughts on this whole discussion? I'll be keen to hear. Remember to subscribe and support this channel.
Hey guys, so I keep getting these idiotic comments from MAGA saying that hospitals aren't going to close, but that's ridiculous. We know they are. We're getting reports out of multiple states saying that several hospitals and healthcare facilities, clinics are closing. But there are some businesses, some agencies that actually do financial analysis for healthcare facilities across America. And so I'm just getting ready to read to you some of these pending closures for various states. And of course, we know the red states are going to get hit the hardest. They really are getting fucked. So first up, Alabama. Man, you guys are really getting it. 28 hospitals at risk of closing. 23 of those are at immediate risk of closing in the next 2 years. Let's see here. We got Arkansas. 30 are at risk of closing. 11 that are at immediate risk of closing in the next 2 years. Georgia, man, you guys are also getting screwed. 20 hospitals at risk of closing, 9 at immediate risk of closing in the next 2 years. I wonder where all of those people are going to go, and where are the employees going to go, and what is that going to do to your economy? Like, this bill decimates the healthcare industry, and I don't want to hear anybody else saying shit about how it's not. Shut up. Illinois, I know you're a blue state, but you're also getting fucked. 17 hospitals at risk of closing, 9 at immediate risk of closing in the next 2 years. Oh my God, Kansas, whew, I gotta take a breath, y'all, because this shit is wild. Kansas, 66 hospitals at risk of closing, 29 of them in the next 2 years, immediately. Kentucky, you're getting fucked. 4 of them are going to close immediately. 16 are at risk of closing. Louisiana's getting fucked. 25 hospitals at risk of closing. 7 in the next 2 years. Let's go down here to Mississippi, because, man, Mississippi is getting it. 36 hospitals at risk of closing. 20 in the next 2 years. Montana's getting it. Nebraska, we already know you're getting it. We've heard that already. New York, man, I'm sorry for y'all, because you guys tend to vote the right way. New York has 29 hospitals at risk of closing, 18 at immediate risk of closing in the next 2 years. Let's take a look at Oklahoma, because Oklahoma's really getting fucked. You guys, 47 hospitals at risk of closing, 23 at immediate risk of closing in the next 2 years. Pennsylvania have 9 up for immediate closure in the next 2 years. Oh boy. Texas, Texas, Texas. You guys fucked the rest of us, and now you getting ready to understand what getting fucked feels like, because 87 hospitals are at risk of closing, okay? And that's like almost a 60% risk of closing. 22 in the next 2 years. Talk about fuck around and find out. Y'all really getting ready to find out. There is a whole list on here of each state. There's only a couple that are immune from this, and I think it's like Utah and New Jersey. So we really got fucked. MAGA and Trump and his billionaire buddies have fucked the working class and the middle class. And it was also they could give these billionaires a tax break, so their income goes up. And there are a lot of MAGA who are going to suffer from this shit, but they're too stupid to realize it. So, anywho, 2026, the midterm elections are right around the corner. You better get out there and vote like your life depends on it, because it really does. I'm going to put the link to this in the post so you guys can see exactly what I'm talking about. Have a good day, y'all.
If you haven't seen it in the news by now, it is estimated that 12 million people will be losing their Medicaid coverage. And I say coverage just because I feel like there are a lot of misconceptions and myths around what Medicaid really is. So I have a background in public health. I've worked in the Medicaid space, and I'm currently working in the health system. So I feel pretty qualified to talk about what is going on and the long-term impacts of what everyone will experience, whether you're an insured or non-insured person. So to start off, Medicaid is a type of coverage, and many times it's a line of business within many of the payers. So I live in Illinois, and here we have Blue Cross Blue Shield, Meridian, Molina. These are typical payers that you see, and Medicaid is one of their lines of businesses. If you have insurance covered through your employer, you might have Blue Cross Blue Shield, for example. This is important to note because there isn't a Medicaid insurance per se. There are many different names for it, and for example, in Illinois, it is Illinois Health Choice. That is the Medicaid plan. And I'm sure in other states there are different plans, so there's different names given out there. Also important to know that because there are multiple payers that have Medicaid as a coverage plan, they all use the same hospital networks. This means that wherever you seek care and you're someone who is insured, most likely there are Medicaid patients that receive care at the same hospital systems and clinic that you currently do. I want to give a little bit of background of how our taxes work and how health systems get paid. So we all pay taxes, and federal government will collect these taxes, and every health system and hospital gets currently reimbursed a percentage of those members that they see that are Medicaid members. So for example, let's say I am hospital A and I saw 20,000 patients who were on Medicaid. I will then receive a reimbursement rate from the state, and they'll say, I'll give you 90% of the reimbursement of what you paid for the Medicaid members. The reason why our taxes pay for them is because these patients don't pay any out-of-pocket cost. If you, for example, are insured and you go see your primary care doctor, you might have a $20 copay. Someone who's on Medicaid won't have a copay. Therefore, they are being covered through our tax dollars. With the bill that is going to get passed, what will happen is the state and federal dollars will reduce the percentage in which hospitals get the reimbursement rate. So if we currently receive 90% of the reimbursement rate, it might decrease down to 50% of the reimbursement rate. Regardless if a patient has insurance or not, they will continue to seek care, which just means that the hospital itself will need to pay for those costs. They will not be reimbursed. So most likely there might be some health systems that may not be able to operate and sustain themselves. This is the part where I feel like people don't understand that even though if they have an insurance, they will see the repercussions of this bill. So because hospital systems need to be reimbursed either by the state or by private insurance, there will now be still a pool of people who will need to receive care. If Medicaid patients aren't able to get the preventative care that they need or continue to maintain their illnesses, most likely these types of patients will just seek care when they end up in the emergency room. And by the time they get to the hospital, they will have much more advanced and chronic conditions, meaning it will be still more expensive for hospitals to take care of these patients. If there are increased rates of people seeking emergency care, this will affect everyone because we're all part of the same network and we're receiving care at the same clinics and health systems. So now, most likely, there will be way longer waits in all of the emergency departments. Some hospitals might have to cut some of their departments. Some programs might need to be cut, and some departments might completely have to go away because they have to sustain themselves. So this bill is really impacting everyone. And something else that I wanted to clarify, I think that there's a lot of misconceptions that this is some sort of free handout. And I want to say that Medicaid patients do not receive any sort of checks. I don't know where this is coming from, but Medicaid patients do not receive any sort of check. All that they do is that their coverage is paid for. They don't have any out-of-pocket cost, but they're not taking home money. And in order for you to qualify for Medicaid, you already have to have such a low income. So for example, in Illinois, you need to meet 138% of the federal poverty line. And the federal poverty line is like $17,000 for one individual. I don't know where these misconceptions are that these Medicaid patients are mooching and living these extraordinary lives, because that is not the case at all. Lastly, we're probably still all going to continue to pay our taxes. So don't think that because this bill was passed, we'll now all magically receive a 30% reduction within taxes. I'm sure there'll be something else that we will pay our taxes into. So there's no win-win here.
Hey guys, I popped in for a minute today. I just wanted to pop in and wish a certain group of people a happy 4th of July. I'm specifically talking about Trump voters. I want to wish you a happy 4th of July. Did you know that that budget bill passed yesterday? And it's pretty soon, a lot of you Trump voters, you're not going to have a lot of things that you had it when 2025 started out. You're not going to have a lot of things that you had before you voted for Donald Trump on November 5th, 2024. Particularly one state that's being bitch slapped is Nebraska. You know, it was announced right after Trump took office, and they canceled the subsidies to all those farmers in Nebraska, and they were all going belly up, and they were predicting that Nebraska would be bankrupt in 6 months. I'm talking to you guys specifically. There's another bit of news I want to share with you on this happy 4th of July day. I just heard word that one of y'all remaining hospitals has just announced that they're closing. Yeah, Nebraska, you're losing your hospitals too. See, after that bill was signed, and in that bill, everyone except for Trump voters know that they're cutting the Medicaid and Medicare. And with that being cut, that's going to cause a lot of hospitals to close. And yours in Nebraska has already announced that they're closing. Happy 4th of July. I hope those fireworks bust your ass right in the face. Because you deserve it. That's exactly what you deserve because you bust the entire country in their face. So now, when your farmers are already belly up, you should be going bankrupt right about now. Maybe next month. Because 6 months from January, yeah, that's about July, August. Okay. So you should be going bankrupt pretty soon as well. And now they're closing your hospitals down. So, when y'all have these medical emergencies, you won't have a hospital to go to. Happy 4th of July again. I just want to keep reiterating this. And I want to keep focused on this. Because I really want you to see your handiwork at work. I want you to see your choicing skills and the ramifications from them. And also, get ready for any of you out there, Trump supporters, who Mima and Pawpaw are in medical assistance, senior citizen homes. Go and clean out that junk room in your house and put in hospital beds and bedpans, because you're going to have to bring all them old folks home. Because see that Medicaid that was in that bill yesterday that they signed that y'all cheered? That's going to cut off support. Yeah. Financial support to people who are living in those homes that y'all don't have to deal with. Well, get ready to start cleaning up piss, wiping ass, and making sure medications are given on time. And you know that Mima and Pawpaw, who are probably really grumpy, maybe be dealing with Alzheimer's or having those, let's say, little nasty outbursts, be ready to endure that too. And don't go abusing them old people. Don't go abusing them old people because you're frustrated because you got to take care of your family now that you voted this shit in. And once more and again, happy 4th of July. And before I get out of here bringing all this great news to you of what your vote is bringing on to you, before I get out of here bringing you all this great news of what your vote has done to you, I just got one question. Nebraska! Your hospital is closing. Is it great again yet? Nebraska! You'll be going bankrupt pretty soon. Is it great again yet? Nebraska! Your farmers are losing their farms. Is this what you call great again? If it is, I'm glad you got it. Because it doesn't fit a better group of people than you. Happy 4th of July.
Hey y'all, look, here's another idiot MAGA who does not know what they're talking about, who doesn't care about the rest of us. Oh, did the sky fall? No, but it's getting ready to. An estimated 500,000 people, and that's from George Washington University, not me, are going to be put out of work because the healthcare industry is going to be decimated by these cuts. What you don't understand about the economy, because I'm guessing you don't understand much about anything by this comment, is that $1 trillion in cuts to Medicaid and $500 billion to Medicare, it is such a huge cut that there are going to be numerous hospital and other facilities and outpatient clinics that close. There are going to be numerous providers that stop taking Medicaid and Medicare. There's a lot of providers that actually don't take Medicare. So if you look at like specialty places, especially with mental health, good luck getting care with Medicare, okay? Because it's already impacted it because the reimbursement rates are so low. But you don't know this shit, and you're just on here commenting. According to George Washington University, there are an estimated 500,000 jobs that are going to be lost. And on my other post, and I put the link in there so you can read it yourself if you know how to read, there's going to be as many as 700 hospitals closing. So I don't know what state you're in, but I'm guessing it's probably a red state, and you're probably getting ready to get fucked. But oh well. Anyway, so don't get on my post with your bullshit because you don't have enough intelligence to understand what this bill means.